Ethical Perspectives on the News is produced by the Interreligious Council of Linn County, which is solely responsible for its content. The views and opinions expressed on this program do not necessarily reflect those of the staff and management of KCRG TV9.
Hi there, and welcome to Ethical Perspectives. I'm your host, Quinn Pettifer with the Gazette, also your moderator for today. And Ethical Perspectives, just in case you are just tuning in for the first time, is actually a weekly segment that allows us to talk about both local and national issues by gathering community leaders that are working in that space, gathering them together and talking through those pieces. And I'm very excited for our panel today. Our topic today is actually on nonprofit collaboration and the power and opportunities that go with nonprofit collaboration. So before I introduce our panelists, just to kind of set this up for our viewers, we're going to talk specifically about human and social service nonprofit collaboration today. But I think that this is applicable in a lot of different nonprofits when it comes to just the work that's being done individually and just the risk versus the reward when it comes to determining whether or not an organization can make the move to actually collaborate. What's in it for the organization as well as what's in it for the customers, the audience that they serve. And with me today are three shining examples of nonprofit collaborators. And so without further ado, I'm going to have you guys introduce yourselves and tell us a little bit about your role and your organization, your mission, and your work. So I'm going to start with you, Kim.
Great, thank you. Well, my name is Kim Guardo, and I am the director of the Food Reservoir at HACAP. And HACAP is Hawkeye Area Community Action Program. And we are a local community action agency that works to fight poverty. So we have a lot of services that we provide to individuals and families in our community that work to break down barriers and help families become successful. So we have programs like Head Start, weatherization, LIHEAP, along with health programs like WIC, Child Health, Maternal Health, and our Food Reservoir that is the local Feeding America food bank that provides food for all of the local pantries and soup kitchens and feeding dining sites around in our community.
So you're busy all year round, but I think it's safe to say you're probably entering one of your busier times of year with the holidays and winter months coming up.
We are, yes, we are busy all year round.
I don't know if you really have a downtime necessarily. None of you do.
Right. I think we're all busy year round.
Yeah.
The holidays is busy, and we have a lot of programs that serve families at holiday time, and we want to make sure that everybody has food to eat and all the kids have happy Christmases, so we work together with other community partners to make that happen.
Excellent. Well, thank you for joining us today. And you actually reached out to our two other panelists when I had reached out to you just about this work that you do. So thank you for that as well. Tricia, why don't you introduce yourself? And
I'm Tricia Katzman, and I am the Community Health Manager at Linn County Public Health. At Linn County, we do a lot of services for the community. I oversee our clinical services in our Community Health Assessment and Planning Group. But we also have our aquatic and food safety group, we have healthy homes programs, and we also do air quality and air monitoring, wells and septic. So public health is kind of a gamut of things that we have going on. But specifically what brought us to this group is the work that we do through our clinical services and the clients that we serve.
A lot of collaborations in your space, no matter what service you're concentrating on.
Absolutely. I think I'm a professional mediator.
You are.
Yes.
You'll be moderating next time, right?
Yes.
Last but not least, Megan.
Hi, I'm Megan Brainish. I'm a project director at the Abbe Mental Health Center here in Cedar Rapids. We serve an 8-county area here in eastern Iowa. We are actually celebrating our 70th anniversary this month for providing services in the community. We provide a variety of outpatient and community-based services for clients with mental health needs and substance use disorders.
Excellent. Well, thank you guys for being here today. And what sparked this conversation as the Ethical Perspectives Planning team was talking about this topic was just the impressive amount of services that our region offers an individual and their families, but some of the challenges with just being able to understand who does what, navigating through that, having access to all of the different services is one challenge, certainly just understanding all of what's out there, but then also the ability to treat the whole self. So if someone is coming in for one reason without being asked, or encouraged to do so, they might be depriving themselves or the people that they are representing of other services. And that's really what sparked this. Let's take a look at what nonprofits are doing in reaction to this. So tell me a little bit about just that concept. We're going to get into My Care Community specifically, but let's first talk about just identifying a need as far as the client is concerned. Anybody talk on that? Or,
I think we all have different opportunities to assess needs in the community, whether it's through surveys or conversations or focus groups or things. We all have different connections to our clients, and our goal is to be responsive to what their needs are. And so that's where we have to collaborate, because we as nonprofits, we're not situated to serve the entire population, the entire person, the whole family from just through our doors. We need to work together to make that happen. So I know at HACAP, we do extensive community need surveys, and then we look at what are those needs, what can we help in that, to work towards that effort, and then look to our partners in the community. What else, how can public health, how can others in the community help to really work around that client and help them be successful?
so there's that loosely based understanding, the loosely based definition of this is a benefit, this is an advantage for us. If you have a client that you're communicating with, it makes sense to make that recommendation. Taking it to another level is an actual formal structured system, and that's where we get into My Care Community. So tell me a little bit about My Care Community, just a little bit of the history and how it came about. Let's start there, because I know it's an amazing system that we want to learn more about.
So I'll take kind of the lead with this one. So My Care Community, it really started off as a grant through the Iowa Department of Public Health. Iowa was one of 11 states in the nation that received the State Innovation Model grant. And so from there, they chose 11 community partners to work on fixing and addressing care coordination within their community. And so Linn County Public Health received that grant. We applied for the money. We received the grant application. And so that was in 2016. So this started as what we called it was the SIM grant and the C3 project. Care coordination, community care coordination was our kind of model. And so it was really bringing our community partners together, having some real honest conversations on what's working in our community, how is it working, really focusing on what is best for the client. And there was really some really good conversations came out of that, some tough conversations came out of that. Our system was broken. It wasn't smooth, it wasn't necessarily client friendly. We were getting the job done, but maybe not to the best of the client's ability, to organizational ability either. So it was more cumbersome for the client, it was more cumbersome for organizations. And when we talk about organizations such as nonprofits that have usually a very small budget and are very time constrained on getting the client in, getting the services provided, and getting the next client in, it was not something that was user friendly for a lot of clients entering the system. So the coalition sat down and really started looking at how to fix that. And one of the clear things that came out after doing some research out, what else is going on out there in communities similar to our size, but also larger and smaller communities. And it was decided that looking into something new and innovative for our community was looking at a platform, an electronic platform, referral and closed loop system. So instead of client A coming to see Kim at HACAP and needing to make a referral to Megan at Abbe, we would be able to start looking at this client from a care coordination model, and that individual would be able to be in the system. And so organizations could communicate about this particular client. And so it was really then spent the first year and a half of looking at what platform out there could serve the needs that we needed. From there it grew, and we got partners. The grant could not pay for the platform, and so it became partnership built in. So yes, there was grant funding to pay for some of the work being done, but the actual growth of this initiative was all the partners bringing money to the table and chipping in and making this happen. And then from there, as all grants come to an end, we knew that this was something we didn't want to see end. And so what we did is work with our partners, branded ourselves, because the innovative state model SIM grant, the C3, that is actually a targeted program across the nation. And so we needed to kind of rebrand ourselves. And so through some conversation, some planning in that, we came up with My Care Community was the name, and then we came up with our own branding, marketing material so people would know who we are, not just from that perspective, but each organization that participates in that.
I appreciate the C3, but My Care Community, rolls off the tongue a little with a little bit more ease than.
It sounds a little more user-friendly too.
We're an acronym-heavy community,
Yes.
so it's good to go straight to the title. Excellent. So tell me a little bit about. We're going to get into a little bit more about some of the planning and getting the nonprofits all together. It's great to see where it is right now. Can you give me give us all a view of what a client experience would be like using My Care Community? So from client perspective, what's the process?
So one of the things that we heard from focus groups that were done in the very beginning of the grant process was that clients needed to tell their story. So as Tricia mentioned, the burden of receiving services had before landed with the client. And so in order for them to receive services, they needed to go to door A, and they needed to take a bus or get transportation over to door B, to get to door C, to finally get some services maybe at door D. And so one of the things that we've really worked hard to do is to bring that all together so the client doesn't have to tell their story at each of those locations. So the goal is, and we're still in the process of getting there, but the goal is that when that person walks in the door, we can connect them with services at all of those locations, and they don't necessarily have to go there to walk in the door and ask for that service. So that's the beauty of the electronic system, is that we can make that referral with ease and looks at the full scope of the client. So one of the things that we talk about a lot are the social determinants of health. And those are all the things that affect the client's overall health and well-being. So things like transportation, childcare, housing, healthcare, all of those things go together to be able to, we want the client to be successful. And so helping the client break down some of those barriers and access the services that they need to be successful is the overall goal of what we do.
Some services will refer to them as client intakes. I've heard it as an intake, which is a little bit more a clinical term. But the idea of having just one of those conversations seems like, okay, that's great. I don't have to keep repeating myself. It's not always the happiest of times, or it could be an emotional situation where it's brave enough to offer that information once, let alone multiple times. So that is definitely a positive. Is there check-in points with the client? So I'm just going to use these. So let's say a client perhaps shares a certain amount of information at first conversation or first intake, but maybe they have other things that come up, or maybe they're not necessarily ready to share 1,000% of their situation. Are there check-in points along the way of a client experience, or is there a way to see just has anything new come up since we first talked to you? I don't know if that's...
So one of the things that we've got built into our system is a survey, a social determinants of health survey. So when they come in initially, we can complete the survey and find out where they're at with certain things. What are some challenges they're having? And then as they continue through working with different organizations, we can touch base on that survey and update what needs they have maybe at that time, so that we can touch base with them. Because oftentimes families aren't going to just come in and tell you their entire story. Right. They're going to tell you what you need to know to get some help that day. And so we know that that's how it works for families, and we want to offer an opportunity. The other thing that we're hopeful is that we can build relationships with families, and so they can see, I trust this person at public health, so I'm able to tell them this story that they might not tell us at HACAP because it's a different relationship. So we want to build on the strengths of all of our organizations together to provide the best client experience for the family.
And some of these clients have relationships with your organizations already, so that's probably a helpful tool as far as, okay, I know Megan, and so I'm gonna, have these conversations with Megan, yet this system is actually a little bit more structured than the informal, hey, Tricia, you might, I might have a a referral for you. So tell me about the benefits that you guys have experienced as participating nonprofit. Well, actually, no, I'm going to back up. Tell me about the experience of getting nonprofits on board with this structure, because at surface level, you'd think, why wouldn't you? I mean, it just makes sense. But the reality is, nobody thinks of nonprofits as competitive. And ideally, like, you'd hope that the competition isn't to the point where no one's willing to play together. However, for funding, for advocacy, there is a little bit of competition, right? You gotta, you gotta make sure that your organization is protected. How did you guys talk through that as you were creating the system?
I would say change is hard.
Yeah.
And so trying to figure that out, I think some of the barriers are when you are so limited in time and trying to dedicate time to doing something new. And we are all funded very differently with different rules and regulations, and so trying to come up with a system that we can it meets all of our requirements, it meets all of our needs, and will serve all of us was pretty impressive. It was a big task to take a look at, even just kind of agreeing on some of the paperwork and questionnaires and things like that. Took us quite a bit of time to get through.
Well, and it's not just staff, it's board members, it's volunteers, and it's, clients. I mean, so is there communication strategy? Like, once your organization's decided we're going to be a part of this, was there a lot of, okay, I need to educate other staff members, board members, people that have a connection to our organization about why this is a good thing? Or was everybody like, yeah, great, awesome, let's move forward? I'm guessing no. I mean, I don't work for a nonprofit, but I've been around them enough. I mean, I think that.
I think, with coming from public health, like, we really try to bring people together. Like, we bring organizations together, because a lot of times it's more about the community partnerships. We try to build those, maintain them. So we are less competitive for funding and some of those things. We want to make sure we are impacting the health of our community, whether that is working through collaborations. So I think one of the reasons for us, it became like a no-brainer that we want to do this, we want to get these people at the table, we want to make this move forward. However, acknowledging that there were going to be some of those difficult conversations. There's some client information that is more protected than other client information, and so if my client is coming to the health department for a specific need, that client might not necessarily want HACAP, if they need food, to know what they were at the health department for. And Abbe, being a mental health and behavioral health organization, that's also a whole different level of security and confidentiality. So it was also like bringing that piece in, all of us wearing our hats of the people we work with, but also the organizations where we get funding from, how we operate. So it was some tough conversations, a lot of, I think it's also different when you have the doers at the table, taking that back to our executives, our leaders, and saying, hey, this really is good. And that's where the momentum really started. It was once we at the table, the doers were like, yes, you know what, we will figure this out, we will make this work. We were able to take that back to then our leaders and say, we need to do this. And then everyone all of a sudden started talking. It was like, boom, okay. Now, was there ugly conversations once in a while? Probably. Luckily, most of that didn't happen with us, so we were fine. Those were other levels. But I think for the most part, we knew the system was broken. We knew the system wasn't client friendly. And everybody sitting at that table, it wasn't about funding, it was about the clients and the families we serve in our community. And that's what the ultimate reason that we could get past everything else that may be different between all of us. The end purpose was to improve the health and well-being of our residents, our community partners, and our community members.
Definitely. How many agencies are currently officially part of My Care Community as of now?
Oh, geez. So one just added to, I believe we're at,
I would say 13 steering committee members.
Okay.
And 19 total. 19 or 20 total.
Wow.
Go to our website, and that has the most. I just updated it today with all of our current community partners. But we have a steering committee level, and then we have all of our partners that have access to My Care Community. And so I believe we're right around 1920.
Are there certain services that you're hoping to add to the network, or is it just you have your kind of like, oh, like this is the dream team right here?
You know,
or
there are so many services in the community that are not connected to our current system, and so as we, as we're trying to serve clients, there's partners that we'd like to refer to within the system that are not currently part of that. So we're continuing to work on that, and the goal would be to blanket the entire community with folks so that anyone who walks in our door could refer to anyone in our community, but that's going to take some work.
Okay.
I would also say, just with the fact that this really stemmed from healthcare and your typical social service agencies that address those. So I think this is going to bring us into bringing some of those non-traditional partners that we want at the table that address other needs. When we talk about social determinants of health, it's not just your mental health, it's not just healthcare services. We want transportation, we want housing, we want those other folks that have impacts on how our community thrives. So those are going to be some of those folks that we're not the early adopters, and it's simply because of how the grant was rolled out. But I think we're acknowledging as the need for the referrals through the clients. That's what's going to drive that next group of folks we target.
Yeah, anything new. You've got, I mean, it's anything.
Yep.
A new phone, all the way to joining up with a network like this. I mean, you've got your early adopters, you've got people that are like, I'm just going to kind of sit back and wait and see. But as you guys are having success, are there plans to show examples, testimonials, things like that from either the agencies that are involved or the clients themselves? Is there a way to kind of tout this, or is it just more like as the momentum grows?
I think at this point we've kind of been riding the momentum, and partners have been reaching out to public health specifically to try to get onboarded onto the system, and we've been talking to our partners. I think one of our biggest goals is to prevent that duplication in the community, and so if you've got other agencies who aren't already in MyCare community trying to partner, getting them to our table to hopefully join something bigger to make it more sustainable and effective.
So what are some of the lessons learned so far? Have there been any moments where you're like, we need to pivot this, or we need to try something new? No?
I think the first thing that comes to my mind is really the trust that we've built amongst our partners. We spend a lot of time together, especially in the beginning. We spend a lot of time in talking about how we can build this system, how we can grow the system, how we can train others on the system, how we can bring on new partners. And with a collaboration, communication is the key to everything. And so making sure that we have open communication and that we have trust between us as partners so that we can have honest conversations and say, you know what, I'm not there yet, or you're doing that really well, I need help, can you help me with this? And I think we've had some really great honesty amongst our partners, and I think that's huge. I don't know that it's unique to us in our collaboration, but I think that when you have that kind of trust level between partners like we do, you can do a lot more for the client.
How about the clients themselves? Just in terms of approach, in terms of introducing the system to a client, have risks or concerns, you kind of touched on it a little bit about just some levels of information are more sensitive than others. What's been the client reaction to this experience, those that have embraced it and have utilized the system?
I would say, just from my understanding, when we've had some come into our clinic, it's really sitting down and having them understand what they're signing or agreeing to. I think it's different. It's a different sell than getting their permission of, oh, I'm going to draw your blood, or I'm going to provide you this service. This is I want to be able to share your information with these other partners that I'm going to be able to refer you to, because I'm not the housing agent or expert. I am not the food. I don't have access to food at our organization. I need to be able to make that referral to another organization. If by you participating in this initiative, in this group, you will be able to access those services, and those services will be contacting you. You do not need to contact them. This really takes the burden off the client and really puts it on us, because then that referral is made to our organization and we get notified that we need to contact that client. So, and again, it's explaining to them, what you shared with me here doesn't necessarily go there. I just am making a referral that I know you need access to food or rent assistance or whatever that may be. That's so I can share that piece of that information. The rest of this stays with us. That's part of who you are with me. That is not necessary, but I want to be able to do this service for you. So I think that's really been, it's taking that extra 5 minutes to really explain to them so they understand what they're signing up for. They're understanding this is for us to share the pertinent information for them to get the services that they need. And they really rank it by more their need. What is their highest need at that moment in time?
I would also add that I think a lot of the technology platform is kind of behind the scenes for the client.
Yeah.
You know, they're not interfacing directly with that system. It really helps our agencies take better care of them. It gives our agencies better access to information on community resources. It helps us, you know, track referrals in a more timely manner, knowing if things are accepted or if we need to try somewhere else. So I would say they wouldn't notice as much, but potentially our better ability to help them.
It's all about building those relationships. So this model is full steam ahead, working strong. Do you see this kind of model working with other nonprofits and potential collaborators? I mean, I know our community works, you know, we've got nonprofits in community development and arts, culture, entertainment. Do you see something like this being a possibility or having potential for others that might benefit? Maybe?
I think so. I mean, the goal is to whatever services a client needs to be successful. So whatever that is that we can help them with, we want to bring on new partners to be able to provide a most comprehensive service as we can.
Sure. So what's next for this program in 2020?
We have a lot of goals ahead of us. I think it's really bringing on more partners, identifying those partners that we talked about earlier that are really missing from our group right now so we can make those referrals to. And I would say the end goal is to take our community clients and families from crisis to thriving. And the end goal is that. And how we get there is going to come in many multiple ways. But I think that's the ultimate goal, to get us there in the next several years.
Excellent. Great. Okay, so we have a couple more minutes. So I'm going to ask each of you from your own organizations, because you all have so much going on. How can our viewers get involved if they would like to know more about My Care Community or your specific organizations? So since we started with Kim, I'm going to start with you, Megan.
All right. For more information on the Abbe Mental Health Center, you'd be able to visit our website at abbehealth.org.
Excellent. Great. Tricia?
And I would say if you want to get involved with Linn County Public Health, you can find us at linncountypublichealth.org. Or you can also, if you want to get involved with My Care Community, that is also a web page, mycarelinnco.com, or you can email mycarecommunity.linncounty.org.
Excellent.
And you can always find HACAP at any of our locations or hacap.org.
Excellent. I want to thank you guys for not only being here today, but also being leaders in this very important initiative. And congratulations on the work so far within My Care Community and being a shining example of nonprofit collaboration. So thank you for being here. Thank you to all of our viewers for tuning in to Ethical Perspectives. I'm Quinn Pettifer with the Gazette, and we will see you next time.